As communities continue to work to prevent new surges of COVID, including from the fast-spreading Omicron variant, I've heard the call from chiefs and communities for faster access to financial resources to prepare for outbreaks, implement additional public health measures, and respond quickly to COVID-19 cases to prevent widespread infection. So to help with those efforts, Indigenous Services Canada is flowing $125 million of COVID-19 public health funding directly to First Nations, self-governing, and modern treaty holders across the country to support their ongoing public health efforts. This additional financial support will help First Nations in their efforts to enhance their community surge capacity to protect against COVID-19 infections. Some examples of how the money may be used could include to administer vaccines and boosters or to conduct rapid testing. It could also be used to pay for surge staffing and other resources, food security, or other supports for people in isolation, or updating, reviewing, and activating pandemic response plans. The funding can also be used in a variety of other flexible means in a way that communities determine that will best protect their members. Speed of support matters when a community is under threat of an outbreak, and we will continue to support Indigenous leaders and communities as they work to protect their members. The money will be allocated using the Indigenous Community Support Fund methodology and will include an allocation to the First Nations Health Authority in British Columbia. The allocation and its temporary implementation criteria have also included careful considerations for needs of remote and isolated First Nations. The Indigenous Community Support Fund also remains available to Indigenous communities and organizations. This needs-based fund gives First Nations, Inuit, and Métis communities and organizations the flexibility to design and implement community-based solutions so that they can prevent, prepare, or respond to the spread of COVID-19 within their communities. Indigenous Services Canada regional offices and regional medical officers of health across the country remain available to assist First Nations, Inuit, and Métis communities and organizations if they need immediate help with an outbreak or support such as temporary infrastructure, rapid testing, or PPE.
As of January the 18th, over 1 million vaccine doses have been administered in First Nations, Inuit, and territorial communities. And of those, over 85% of individuals aged 12 and up have received a second dose. Only about 20% of adults have received a booster dose, and over 40% of children aged 5 to 11 have received at least one dose. As of January the 19th, there are 5,097 active cases in First Nations communities. Sadly, there have been a total of 588 fatalities with COVID since the beginning of the pandemic.